check out the Oberst house here. We're already all set up for Halloween. So this is probably, I don't know, $10 for this thing. Got it from Lowe's. That's Bogey. He's got his own little bones. So check it out. Check out this skeleton hanging. We've got 6 for each of our trees here. So we've got the appendicular skeleton, which consists of the arms and legs and the girdles, pectoral girdle up here, and the pelvic girdle down here. Let's start from superior to inferior. The skull and the face, the frontal bone, the supraorbital ridge, the supraorbital notch or foramen, the orbits, the nasal bones, glabella, which is right between the eyes. You've got the temporal bone right there, and the mastoid process of the temporal bone, and the external auditory canal of the temporal bone. And you can see the condyle of the mandible here, fitting right into the fossa, temporal fossa there. And you can see the alveolar processes of the mandible and the alveolar processes of the maxilla, and this is the vomer. And you can see that there's the perpendicular plate of the ethmoid bone, which is that straight line in there, and the nasal cavities on either side. You got 2 temporal bones and an occipital bone. You know the sutures. There's a sagittal suture and the coronal suture and the squamosal suture and the lambdoidal suture. 7 cervical vertebrae, 12 thoracic vertebrae, and 12 corresponding ribs, 5 lumbar vertebrae. The sacrum, the coccyx is missing, would be down here. Of the pelvic bone, there's the pelvic girdle. In the center, there's this triangular structure, that's the sacrum. And we've got an innominate bone, or an os coxa, on either side. Right. This is the ilium, looks like a big elephant ear. This is the bone you're sitting on, the ischium. And pubic bones come together here. There's a piece of cartilage. And this cool hole here is called the obturator foramen. Muscles and nerves live in that vicinity. Yeah. We got a sternum in the front. There's the manubrium and the gladiolus and the xiphoid process of the sternum. There's a clavicle. There's the acromial extremity and the sternal extremity. There's the scapula, all right? Scapular structures. This is the inferior angle, or pointy angle of your wing. This is the superior angle. This is the spine of the scapula, and this really important structure right here is called the acromion process. The acromion process is going to join with the clavicle, and it's called the acromioclavicular joint, otherwise known as the AC joint. We've got our ribs. You know that ribs are bony. They join in the back, the thoracic spine. There's a joint right there. And when we breathe in deeply and exhale, there's bucket handle motion, which brings your ribs up and down. In the anterior, the ribs end here with a blunt sternal extremity, and then they continue as cartilage. That gives the rib cage some flexibility so we're not breaking our ribs all the time. Man, upper extremity, we've got the humerus, we've got the epiphysis of the humerus, or the head of the humerus. It fits in the glenoid fossa of your scapula. This is the shaft or diaphysis of the humerus. And we've got the elbow. This pinky side bone, I've followed all the way down to the pinky. That is the ulna. This bump on the posterior aspect of the ulna is the olecranon process. So then the thumb side bone, long bone of the forearm, is called the radius. And the radius has got a radial head. It's kind of round and allows you to go palm up and palm down. That's called supination and pronation. It's got a radial tuberosity right here that your biceps brachii, your beach muscle in your upper arm, attaches to. so that you can do bicep curls. Those two long bones articulate at the wrist, the carpal region. Some lovers try positions that they can't handle. Then we've got the metacarpals, 1, 2, 3, 4, 5. Then we've got the phalanges, proximal, middle, distal, proximal, middle, distal. The femur, holding the shaft or diaphysis. The head of the femur. The neck of the femur, which is a place where people often will break it if they get old and also have a fall and maybe osteoporosis. That would suck. The head of the femur fits into what's called the acetabulum of the os coccyx. It's a really deep socket in the hip. Move your hip around now. It's kind of like a mortar and pestle, so it's a really strong, powerful joint. The hip joint, the true hip. So the head of the femur, neck of the femur, shaft of the femur. This is the greater trochanter, lesser trochanter. Distally on the femur, we've got the condyles. This would be the lateral condyle, medial condyle. They sit on, here's the patella, your kneecap. It's a sesamoid bone. It means that it develops inside of a tendon. Then there's the tibia or shin bone, right? We don't call it the shin bone anymore. Here's the tibial plateaus, medial and lateral. Here's the tibial tuberosity, the shaft, and the proximal and distal epiphyses. If you feel the inside of your ankle, there's this prominent bone there. That is called the medial epicondyle. Or the medial malleolus. And if there's a medial malleolus, there's a lateral malleolus. So there's a bump on both the medial and the lateral side created by a different bone. The tibia's got the medial malleolus or medial hammer, is what malleolus means. And this is the fibula. And that goes distally and creates the lateral malleolus. The tarsals, we've got the talus, and this is the talar dome. See how it kind of allows us to go up and down like that? And there's the heel bone, or the calcaneus. Then we've got the navicular and the cuneiforms. Then we've got the metatarsals. 1, 2, 3, 4, and 5. And remember I said that there is a metatarsal styloid, the fifth metatarsal styloid. Feel that bump on the lateral aspect of your foot. Right there. Then we've got the phalanges, proximal distal, proximal middle distal, proximal middle distal. That's it. We just went through the skull hanging from a stinking tree. So spooky for Halloween. Finally, I'll ask you, how do you determine whether this is a male or female pelvis? Look at the angle there and look at the pelvic outlet. It's very small. That angle right here is very narrow. It would need to be wider if it was going to transmit a fetus. Yes, yes. So this is a dude. Know your stuff.